All right, let's talk a little bit about writing CME questions. So, when you have a CME program that's delivered, whether it's by a slide deck or online, oftentimes there's a pre-test which will determine a clinician's level of knowledge before the program. And then there'll be a post-test which will determine the clinician's level of knowledge after the program. So, hopefully, there'll be a change affected by the educational program, and it will show that there's been an improvement, hopefully, in some kind of measure. So that's what the CME questions are for. Sometimes they're requested separately by a client, or sometimes they're included as part of a CME program. But there's just some general strategy for writing these. First of all, you're going to need an example. So definitely get one of those from the client and see how they format them. They're designed to assess whether learners have achieved the educational objectives, and they should reinforce key takeaways from the activity. They should be aligned with Bloom's taxonomy, typically testing knowledge, comprehension, application. They should promote critical thinking, not just recall. So, if you have a question, what was the overall response rate in the Paolo trial? And let's say it was 45%. I mean, you can have that as a question, but it's kind of a lame question. You know what I mean? Like, it's just kind of recalling an overall response rate, and it's not really practice changing. So just keep in mind, you don't want to just have them recall information like that. You want to have them select maybe the best therapy for a specific patient, or just it should just be really aligned with what the program is trying to teach. And it must be, as all CME materials, must be free of commercial bias and written in a fair and balanced manner. And then when you're writing these, you want to make sure they're as clear and concise and unambiguous as possible. A bunch of really intelligent clinicians that have gotten through medical school are going to be really picky about their questions if there's any kind of ambiguity. So be careful about that. Focus each question on a single learning point. You want to avoid negative phrasing. So, which of the following is not, unless it's absolutely necessary to do that, but try to phrase it in a positive way. Make all the answer choices grammatically consistent with the stem. Hopefully that's clear. You don't need to point out an example. Ensure one best answer with plausible distractors. Sometimes you can read a question and you can just tell which one's right without really knowing the topic, because the distractors are not feasible. So just be very sort of realistic and have explanation for both the right choice and the incorrect choice. Be sure, again, to align with the client's examples on that.